morning, colleagues. So this morning we'll be taking practice question 4, May 2023. I'm Dr. Raga. The question is on health management. So the question goes, define health management. Who is a health manager? What are the qualities of a good health manager? What are the functions of a health manager? What are the barriers to quality healthcare in Nigeria? So define health management. Health management involves overseeing, planning, directing, and administrating healthcare systems, facilities, clinics, and hospital networks. It is a systematic process of using resources with judgment to achieve objectives in healthcare. So it entails a judicious use of the available resources to achieve organizational goals. It provides guidance, leadership to administer health at individual, organizational, and systemic levels. Health management comprises community, primary, secondary, and tertiary care provision, as well as policy making and implementation, strategic collaboration for effective healthcare delivery. It is centered around effectiveness, efficiency, and equity. By effectiveness, you are looking at how well organizational goals are achieved. And by efficiency, you are looking at the measure of how the percentage outcome per unit input of resources. And equity, you are looking at fair distribution of resources that are available to the organization. So this diagram just shows the components of healthcare management. Who is a health manager? A health manager is responsible for planning, running, and leadership of a professional, comprehensive, and efficient organization in the healthcare sector. He or she oversees the operations of a healthcare facility to ensure that all the functions involved in healthcare delivery are run in an orderly, cooperative, and effective manner. He is seen as a practical problem solver. So what are the qualities of a good health manager? Good communication skills. A good health manager must be clear, accurate, while communicating information to his or her team. And at the same time, he or she must be an active listener whenever team members have questions or suggestions. So in every organization where there's a good health manager, the health manager must ensure that there's appropriate vertical and horizontal flow of information. Among horizontal flow of information entails a flow of information among people of the same level, while vertical flow of information from employers to employees. It must be optimistic, so it must show optimism. Managers play a key role in keeping their employees' morale up. Every career comes with difficult situations, but one way to walk through them is by maintaining a positive attitude. So as a good health manager, you must maintain a positive attitude. Assertiveness. A successful manager must be able to be decisive and assertive. He must be able to present opinions with confidence. Speaking up about important matters and defending ideas are crucial attributes of a good manager. He must be accountable and transparent at all times. He must show respect and empathy, respect for oneself and respect to others irrespective of their levels. Having empathy exhibits a high level of emotional intelligence. It is a very crucial element in health management. Good managers are authentic. While there are key qualities that good managers must have in common, There's no one-size-fits-all approach to effective health management. So you must try to do it effectively, but you have to be authentic. Learning from mistakes. Good leaders take responsibility when they make mistakes. They know how to ask themselves the right questions and use a mistake as a learning opportunity. They must show ability to manage and resolve conflicts. A good health manager must show the ability to manage time, stress, as well as to delegate duties where necessary. As a good manager, you always have thieves of time around you. So time management is crucial in order for you to achieve the goals of the organization. So this slide speaks further to the qualities of a healthcare leader. He must be humble, visionary. He must act as a mentor to employees and others around him, and must always be ready to be mentored as well. He must display integrity and show readiness to collaborate internally and externally. What are the functions of a health manager? Policy and program development, financial planning. Healthcare managers can oversee many areas of financial planning, which include accounting, planning budgets, establishing service rates, authorizing expenditures, and coordinating financial reporting. Must be ready to assess risks and manage them appropriately. Human resource management. From time to time, managers are required to supervise, conduct the recruitment and hiring, scheduling, as well as training and retraining of staff in different facilities and establishments. Data documentation, risks and compliance management. Healthcare managers must ensure that all aspects of a department or facility meet laws and regulations to ensure safety and other concerns. So must analyze situation, plan, perform and implement them, and from time to time evaluate how well these plans are achieved. What are the barriers to quality healthcare in Nigeria? Quality healthcare in Nigeria can still be perceived as a distant reality. The Nigerian healthcare system is plagued with several challenges. These challenges range from bad leadership, poor policy making, implementation, to shortage of health workers. Over the years, some laudable health policies have been initiated in Nigeria from 1988 down to even 2023. Some policies have been made. Despite these policies, under 5 and maternal mortality is still very high. In 2018, Nigerian healthcare system was ranked 187 of the 191 WHO countries in terms of healthcare delivery. And according to WHO report 2021, the density of health workers per 10,000 was 3.95, 15.96, 0.81, and 0.2 for doctors, nurses, pharmacists, and dentists, respectively. What then are the barriers to quality healthcare in Nigeria? We have them classified under government and leadership barriers. Under government and leadership barriers, we have lack of political will, poor budget for health. Poor budget for health leads to inadequate health resources. Corruption leads to mismanagement of available resources, leading to poor healthcare delivery. Defective policy making process and implementation. Lack of understanding of special health problems in the community. Sometimes when these policies are made and healthcare facilities are associated, the peculiar needs of the community are not sought. So the healthcare and hospital-related barriers, lack of health planning efforts by health agencies, problems of health service accessibility, poor implementation of policies, for instance, NHIS. So there's so much out-of-pocket expenditure for health, poor public health image, inadequate health manpower and training, corruption, lack of motivation among health workers, poor remuneration. Inpatient and community-related barriers will include poverty, illiteracy, poor health-seeking behavior, as well as cultural factors. There are some areas where culture prevents appropriate health seeking behavior. So what are this just an add-on? What are benefits of health management? Will facilitate structured care system, cost control, and better clinical care. These are my references. Thank you for listening.
Thank you so much, Dr. Raga, for that beautiful presentation and concise. You get the time. So now we take comments and questions from the participants first. And let's give the thanks comment on the chat. Okay. So I have a thanks there from Dr. Mamodu. The person has got a many things to say. Thank you. Okay. So can you go back to the question? Okay. I just wanted to add to the barriers that lack of available tools. If we check out most of our facilities, we lack so many tools for working, maybe tests, even tests, and consumables to manage patients, even when we have the expertise to use them. We lack that. And even training, just like you mentioned, lack of training in some specific areas is also lacking. It's also a barrier to quality healthcare. Thank you.
Thank you. Thank you, Chibekele.
Okay, so there's some comment. There's a comment on the chat. Itohan says, thanks for the presentation. Just to add that religion also contributes to health-seeking behavior of the people. Okay. Sometimes religion is also a patient-related barrier to healthcare. Thank you so much, Dr. Itohan. And then Dr. Ede, one of the qualities of authenticity, as you mentioned, can also be adaptability and flexibility, not being rigid. Thank you so much, Dr. Ede. And the others are saying thanks. Okay. That's obviously a beautiful presentation. Okay. So there are no more comments from the participants. Margaret.
Oh, thank you so much. Thank you, Dr. Araga. Thank you, Dr. Ekele. It was a wonderful presentation. They went straight to the point. Chief Chitusa, I don't know if you're around. Chief Remigos, Chief Cookie, or Kopi, any comment? Dr. Fatima, any comment? Chief Bansi, any comment?
Is a straightforward one, and he did well.
That's fine. I think so too. So, Dr. Raga, thank you so much. Thank you. Dr. Ekele, move to the next question.
Comments. Thank you.
All right, thank you so much, Ma. Dr. Brown, Ibapi, I don't know, are you in class?
Yes. Good morning, Dr. Ekele.
Okay, please go ahead. Please share your screen.
Good morning, my teachers. Good morning, colleagues. I'm presenting practice question 5. May 20. Can you hear me? Am I audible?
Yes, I can hear you. Go on.
Okay. So I'm presenting practice question 5. So the question is, an 18-year-old boy was being seen in pediatrics clinic and is now transitioning to adult care. This is the patient. A, you may interact with him. How would you transition him from pediatrics to adult care? Discuss the important issues in the transition of this patient. What investigations would you like to do for this patient? And then finally, how would you manage the patient from now on? Please, can somebody volunteer to simulate for me on this part
To
of
be the simulator.
yes.
Okay. Do you have any volunteers?
Okay. So
Any volunteer?
okay, thank you, Dr. Ekele. So good morning. I'm Dr. Brown. I'm a member of your managing team, and I've come to discuss with you concerning
Sorry,
your medical.
Sorry, is that Dr. Brown? Just a minute.
Okay.
Do we have any volunteers? I will sign. Dr. Chineme.
How do you know?
Good
morning. Okay, no problem.
Thank you so much. God bless you. Okay, Dr. Chineme will simulate for you.
Okay, thank you.
Go ahead. Sorry, before you go on. Ma, please, am I supposed to time him? Give him 10 minutes. Am I supposed to time him?
Yes, well, let's time, yeah.
Okay,
You
okay,
should
so...
not give him up to 10 minutes because he's going to answer some questions.
Okay. Okay, so should I give him 6 minutes?
7 minutes is fine.
Okay, Dr. Babik, you have 7 minutes.
Okay, thank you. Good morning. I'm Dr. Brown. I'm a member of your managing team, and I've come here to discuss with you concerning your medical condition, if you don't mind.
Good morning, doctor. You can go ahead, sir.
Okay, thank you so much. Are you okay? Is this place okay for us to discuss, or you want us to discuss elsewhere?
It's okay, doctor.
Okay, thank you. Is there any other person that you would like to be part of this conversation, or you're okay alone? Can we go ahead to discuss?
I want my mommy to be here.
Okay, so there's no problem. Your mommy can join us for the conversation. You can call her to come.
Okay, she's here now.
Okay. Good morning, mommy.
Good morning, sir.
I'm Dr. Brown. I'm a member of the managing team, and I'm here to discuss your son's medical condition with you. I hope you don't have a problem with that, mommy.
No, doctor, you can go ahead.
Okay, thank you so much. I want to ask, what do you know? What do you know about your medical condition?
My pediatric doctor told me that if I fall down, I'll bleed too much. That's just what I know.
Okay. Yes, that your pediatrician is actually right. Apart from that, is there any other thing that you know about this condition apart from what the pediatrician told you?
She said I should make sure I don't have wounds. I think that's all she said.
Okay.
I can remember.
You can remember. Okay.
Yes.
So what you have is actually a problem with your blood. That's the issue that you have. It's a problem with your blood. The blood has several components inside it. And what happens is that some of these components, they come together in your blood, to prevent bleeding from occurring. And then when you also have injuries, these blood components also come together, to reduce the amount of bleeding from these injuries. That's how bleeding stops. So the problem you have is actually a bleeding disorder, because one of the components that in the blood, that come together to prevent you from bleeding is absent from your blood, is missing. You don't have it in your blood, or even if you have it, the levels of it are very low. So it's very low, or it's absent from your blood. So it's not able to come together with other components to prevent bleeding. And then also, when you have minor injuries, it's also, since it's absent from your blood, it's not able to join other components that it usually comes together with, to stop the bleeding. So that's why your pediatric doctor told you that you should avoid injuries, because of the absence of this component in your blood, there's a tendency for you to bleed when you have any injury, So that's why I told you that. Do you understand what I've just told you?
Yes, doctor, but you said something about disorder component. I
Okay,
don't
what
really
I
know
mean
what
is
that
that,
means.
okay, no, but you know what blood is now.
Yes, I do.
Yes. So what I'm saying is that, they are different. The blood has different components in it, So some of those things in the blood, what they do is that they help to prevent bleeding. There are substances in the blood, there are things in the blood that helps to prevent bleeding, And then even when you have an injury, these substances also come together, to reduce the amount of bleeding. So for you, the problem is that one of those substances that come together to prevent bleeding or to stop bleeding is absent from your blood, or the levels are very low, such
Okay.
that it's not the quantity is not enough, to prevent that. I don't know if this makes sense to you now.
Yes, sir.
Okay. So, and it is something that you have inherited from your parents. There are genes from your parents that were transferred to you, that they are not normal genes, and those genes actually help to, produce this substance in blood, but that gene is not normal. So that's why you're having this problem. And because of that, because of the absence of this substance in your blood, you have a tendency to bleed easily. And that's why the pediatric doctor told you that you should avoid injuries. Very minor injuries can cause bruises on your skin. And then you can even bleed into your muscles. You can bleed into any part of your body. You can bleed into the joints. You can even see blood in your urine. Even from your, even in your feces, when you pass feces, you can see blood in it.
How
So
many more?
bleeding can occur from any part of your body. And then also, depending on the severity of this condition, it's even possible that you can bleed into your brain. So we'll need to do some tests for you also, to know the severity of this condition, so that we'll be able to find out the levels of this substance that is absent from the blood. So this will help us know whether we are dealing with a mild condition, we are dealing with a moderate condition, or we are dealing with a severe condition. This is what we will do for you. So I wanted to ask, are there any questions you want to ask me? Do you have any concerns, that you want me to address, so that we can talk about it?
Okay, doctor, I'm afraid. Are you saying I'm going to die? Are you saying, because you said I'll be bleeding, bleeding, bleeding. Am I going to die? And then they said I'm supposed to start adult clinic, but you've not said anything about that. So I don't know.
Okay, right now, this is the adult clinic. So from now on, we are taking over your care.
Dr. Brown, calm down. These are simulators. What kind of simulators do we have, sir? Are you why are you helping the man do this? I don't understand. Anyway, I think there's no need to continue. Dr. Brown, yeah, your time is up and you actually went completely off tangent, okay? So, I don't know, you need to always read the questions, okay? And answer the question. You might have to do this again because you didn't answer the question. Just go back to the question and read it and see. Okay, so you can see the first question there. They said, this is the patient, you may interact with him. The B part says, how would you transition him from pediatrics to adult care? Those are the major things. You didn't even talk about it at all. Discuss the important issues in the transitioning of this patient. What investigations would you like to do for this patient? How would you manage the patient from now on? So you completely didn't answer any of those questions, not even one. Maybe the interaction with the patient, you tried a little bit, but the thrust of the question, you completely missed it out, okay? So for me, I don't even think there's any need for us to be commenting. I think you have to look at this again and attempt it again. That's my opinion, Sha, but whatever the class says is okay. Dr. Christabel, what do you think?
I agree with you, sir. I agree with you. It's fine by me.
I don't know if Dr. Shitu is on the call. Dr. Shitu?
Yeah, he totally missed the whole point. Dr. Brown, are you with me?
Yes, sir.
Yes. The idea of this discussion is for you to interact with a person that used to be in the pediatrics hematology clinic, I believe, and is now transitioning to the adult clinic. Okay. And this is supposed to be your first interaction. All right. And there were several things that
Yes,
were a little bit not there. Okay. You need to introduce yourself as his new doctor. Okay. And then it's very important to get a lot of his own thought. What does he know, feel about certain things? What are the things that he used to do in the pediatric clinic that you would want to also, that he would want you to also do for him in the adult clinic? You know, you're basically trying to sell your clinic to the young man so that the young man can come in. Okay? You could also decide that if he says he's more comfortable with pediatric clinic and all of that and raises so many issues for the pediatric clinic, then perhaps you start to think of, okay, can I join? Is it possible to still have his pediatricians around, maybe initially before fully transitioning him to the adult clinic? You have to let him know about the tests he'll be doing now that he's in the adult clinic. Are they still the same as the ones he was doing in the pediatric clinic, or are they different? Okay. What are the peculiarities with your own clinic that will change from the clinic he was attending previously? And that is the brief you're trying to sort out here. The whole idea of the question is transitioning a person from pediatric clinic to adult clinic. Yeah. So I think you may. I think you may need to go over it again or do it again. I don't know if you have time for that.
Okay.
Hello?
Okay, sir.
Yeah.
Okay, sir.
Dr. Kelly, are you still there? Yes. Dr. Remigos, I think you should go over it again so at least everybody gets a fair idea of what we're supposed to do here.
Okay, like now, right? You can go over it again now.
Yeah, I think you should go over it again, and then we give him like 7-8 minutes, and then when we're done with that, then we'll now ask him the specific questions.
All right. Okay, I agree with you, sir. So, and Dr. Brown,
yes, sir.
You need to come down to the level of the patient, all right? The patient
Okay, sir.
told you, I don't understand component, this one, you are still using it subsequently. Okay? So, first of all, this person is transitioning from pediatric to adult clinic. He's 18. Maybe he's not even in university yet. He's through secondary school. He's trying to get JAMB and stuff like that to get to university, maybe. Okay. So at this point in his life, the simpler the terms, the better. Okay. You try to simplify some things, but there are some other things that you were using big terms. And he told you himself, and yet you still continued using them. Okay. So he's not even supposed to tell you, he just I've just kept quiet. When you say, do you understand? You say, I don't understand. So you start all over again. So but use simplest terms, the simplest terms possible. Instead of using components, you just say, oh, there are some things that are found in blood. And
Dr. Let me close on that. Sorry, just to add, I always tell everyone, imagining you're saying it in broken English in your head. We know when you're speaking broken English, the terms are simple. Do you understand? So imagine you're speaking broken English in your head, and then you're now translating that to normal spoken English, but in those same simple terms. So it makes life easier.
In fact, before you start, yes, you're right. So before you start, you can even ask him, are you comfortable with English language, or do you want us to use, is there another language you're more comfortable with, So because if you are speaking big torrently with English and he does not understand, like in our side here, some people that will come to the clinic, especially in the north, some of them, they don't understand. Some might even be in secondary school, but their English is not so good. If you are speaking English to them, they will not really follow you. Okay, so you really have to be sure he's following you. Okay, thank you.
All right, thank you, sir. So I think the whole idea is to answer these questions while you're discussing with the patients, to answer the subsequent questions during the interaction with the patients. Okay. Okay, so Dr. Brown, you have 7 minutes again. Okay, Dr. Nememo will still send it for you. Okay, go ahead.
Okay, so good morning. I'm Dr. Brown, your new physician that will be managing you from now on. Good morning.
Good morning, doctor.
Okay. Are you okay here, or you want us to discuss elsewhere?
I'm okay here, doctor.
Oh, okay, thank you. Is it okay for us to discuss alone, or is there someone else that you would want to be part of this conversation?
Doctor, you can go ahead. I'm okay.
I can go ahead. Okay, thank you so much. So as I said, I'm Dr. Brown, and I'm your new doctor who will be managing you from now on. You know that the pediatric doctors have been taking care of your treatment, before now. But now you are 18, so you are moving to our adult clinic, and that's why I've come to see you here today, to discuss with you.
And Doctor, I want
go
to
ahead.
ask why they are moving me. Why are they moving me? I like Dr. Sarah. She was nice to me.
Okay. It's fine. It's fine. Why they are moving you is because you know that the pediatric doctors are responsible for taking care of those 18 years and below, but when you become an adult, when you are 18, caring for you will now be the adult physicians and no longer the pediatricians. Pediatricians are specialized in taking care of children, those below the age of 18 years. But once you become an adult, then the adult physicians will take care of you. But I don't want you to worry, because we will do everything that the pediatricians have been doing for you. We can also join them in these initial stages. We can join the pediatricians, to start your care if that's what you want. But I assure you, that going forward, the same way that you are comfortable with Dr. Sarah, you will also be comfortable with us, because we're here to do everything for you that the pediatricians have been doing for you. So I don't know, are there any issues that you have? Do you want to still remain with the pediatricians, or you want the adult physicians to take care of you?
I'm just scared, doctors. I have my friends there. I have everything there. It's usually a fun clinic. So I don't know. This one you're saying I'm coming to big people's clinic. I don't know if it's going to be nice. I don't know. So I'm just scared, but you said it to be okay. So
No, I assure you it will be okay. We are as nice as the pediatricians. We're here to solve all your problems. Any issues you have, we'll always be here. We're available for you 24 hours. You can have our phone contact, anything you want us to do for you. We can do that for you.
okay.
That's why we're here. So you have no fears. You have no fears coming from pediatrics to this our clinic. It's the same experience, I can assure you, or even a better experience from what you are getting from the pediatrician. So I don't want you to have any fears about that. I want you to be comfortable.
Okay, doctor.
Okay. So when you were in the now that you have accepted that we can take over your care, when you were in the pediatric clinic, what are the things that they were doing for you?
Okay. I usually come to clinic. They tell me when to come to clinic. I come to clinic with my mom, and then Dr. Sarah sees me. She usually asks me about the things I did over the week. She asks me about my drugs. She helps me with my pill count container so that I can be able to know when to take my medications. Just generally well-being. She checks my body. She does some tests.
You have 2 more minutes.
Okay.
That's what she does.
Okay, so no problem. Now that you are coming to this adult clinic, we are also going to do the same things that the pediatricians have been doing for you. It will not be so different from what they have been doing. And even your file that they've been using to manage you since you were a child will be transferred to us here in the adult clinic. So we'll see everything that they've been doing for you, and we'll still manage you along that line. We'll introduce you to everybody in the team here that you need to know, the nurses, the doctors, the laboratory if you need to do any tests, where you need to get drugs, the pharmacy. We introduce everybody to you. We'll open lines of communication for you in case you want to reach out to any of us on phone. And then also, there's something we also want to introduce you to now that you're an adult. We would like to introduce you to support groups, where you will meet other people that have this same disorder, so that you can interact with them and know how they've been managing theirs. Are you okay with that?
Yes, doctor.
So we'll do that for you. And then we'll also discuss lifestyle issues with you here. We can also introduce you to community facilities where you can, maintain a healthy lifestyle by doing exercise. We'll talk about your diet so that you keep a normal weight, because of this condition you have. And then we'll ensure that all the services that you were receiving at the pediatric clinic is also provided for you seamlessly here. So I want to know from you if you have any concerns now that you are moving from the pediatric to this clinic.
Doctor, can I now play football?
Okay. Yes, you can play football. But I want you to know that because of this bleeding disorder you have to be careful if you have to play football. You have to be
Doc-
careful because
Dr. Brown,
yes.
your time is up. I think at least this one is better than the first one. So I think we should just discuss. Dr. Kele, please over to you. Thank you, my simulator. You did so much better this time around. Well done.
Thank you, Chief. Thank you, Dr. Brown.
Thank you.
Thank you, Dr. Neme. Okay, thank you so much, Dr. Brown. Thank you, Dr. Chineme, for volunteering. Okay, so now we'll take comments and questions from the participants first, and then our teachers will come in. Okay, Dr. Francis.
Good morning, our facilitators, our teachers. Thank you, Dr. Brown, for this wonderful attempt. I just wanted to add something. Probably a brief biodata would have helped initially to maybe help create rapport with the patient, asking how old is he, school, what level of education. I think it also help like the best way to communicate with him if you probably have asked that. Then the patient had fear about leaving these pediatricians that he has had good rapport with, that he has enjoyed working with.
Brown,
I think probably
you display the question?
Sure.
Thank you. Sorry, go ahead.
Oh, okay, man. So he had fear about leaving these good pediatricians that he has been enjoying, how they've been taking care of him. So I think an approach to probably addressing that would have been reassuring him that yes, change is a bit hard. However, with time, you'll be able to gain his own trust, and then you have good professionals too as adult physicians, so you'll be able to transit gradually with him. It was nice that you actually mentioned, based on how our teachers actually said that with time, the pediatricians initially could be together with him whenever he's visiting. And then I think probably you would have also added some peculiarities with the adult clinic. It's not entirely different. That would actually reassure him. And then maybe just mention some other peculiarities that are different with the adult clinic. I think those are the things on this. Thank you very much.
Thank you so much, Dr. Francis. Dr. Sani, please go ahead.
Thank you very much for that wonderful presentation. I think my take is he's still yet to address the main issue, is anxiety in the patient. Because patient transiting from pediatrics to adult have their own peculiarities. They have already developed attachment. So there are 2 or 3 important things that he should be seen actively doing. One is to be giving reassurance and compliment to the pediatricians about their work. He should be seen doing that, in short, in the early part, because the patient was dragging, and he was even dragging the discussion up to like the 5th or 6th minute, trying to reassure the patient. So you have to do it as soon as possible, reassure the patient, compliment to the pediatrician for the work done, and probably the institution. Credit to the patient, then the institution, trying to explain to the patient or trying to sell to the patient that, okay, this is how the hostel has been. This is the level of excellence that this hostel, not only pediatric, because the patient has not had any experience with adult clinic. So try to tell him, because it's an institution, it's an institutional credit rather than probably a departmental credit. Then secondly, immediately after that, should try to tell the patient peculiarities, differences between pediatric care and adult care. What he should expect, especially in the adult care. Very, very important, especially the composition of the team, who will be seeing him, who he will be there, and even the nice people, if he had, so he can mention 1 or 2 people, because that's what the patient is trying to mention. Some doctors are very nice. Then the third one is outline what he will receive in the adult clinic, because he must have had some cares there. Then he should tell the patient, okay, this is what we are expecting, the level of care, the investigations, the follow-ups, the routine checkup, and then probably people that will be accompanying him to the clinic and what he will receive. So those are the important things. I think he has tried in the second attempt, but I think he's still yet to address the main issue in this patient. Thank you very much.
Thank you so much, Dr. Sani, for the comments. Okay, let me just take a few comments on the chat, then we'll go back to our teachers. Okay, so there's a lot of thanks to you. Dr. Kopi saying thank you, Dr. Brown, and thank you, Dr. Chineme, too, for very good simulation. And then Dr. Justice says, thanks so much, Dr. Brown. And then thanks so much, Dr. The simulator too, Dr. Chineme, AK. I think that asking the patient if he'd rather stay with the pediatrician or move to the adult clinic might give room for an abrupt termination and might make you deviate from the course, especially if the answer is yes. I feel you made a lot of promises, such as saying that the clinic will be as fun and contacts will be shared. For the football, I think you can assign roles such as being the coach. Thanks a lot. Then Dr. Olaiton says, thanks for the presentation. You didn't talk about the investigation you would like to do for him. And then Dr. Justice says, thanks so much to our facilitators for this amazing opportunity to make corrections. Okay, Dr. Brown, did you take note of them? Okay, Dr. Chineme, please go ahead.
Okay, thank you, Dr. Brown. I just have a few things I want to say. One of them is, just like our teacher said, it's a child, like you're just getting into adulthood. So most times there's a lot of anxiety with it. So as simple as possible. Then I think it's also important to tell him that he'll be taking up more responsibility than he used to in the pediatric clinic, because usually in the pediatric clinic, I'm sure Dr. Sarah does everything. But here it's important to tell him, maybe you have to take up more responsibility. For example, if he comes to clinic, he would have the responsibility of telling us, okay, this is what I did over the weekend, this is what I'm taking, and then, tell a little bit more than what was expected of him in the adult clinic. And then it's also important to be a little bit more honest with him, because in the adult clinic, he's not going to find all his friends there again. So it's important to let him know that your friends might not be here, all of them again, but you can make new friends, you have new doctors around that would be open to, take care of you. Then it's important to tell him, is his medication going to change? Is the dosaging of his medication going to change now that, sorry? Hello? Sorry, I can't hear you. So I am,
Thank you.
I didn't hear what the person was saying, but just to tell him if they are different. I can't hear him. Okay. Sorry, I can't hear what you're saying.
Don't worry, just continue what you're saying.
Okay, sir. So you tell him if he's still going to have the same medications or not. Then the test he's going to do now, is it the same as he used to in the pediatric clinic? Like, are you still going to do the same test, or there may be something different? And then I like the fact that we are going to take him round. We are going to introduce him to the team members that are now going to take care of his care. Then I know for him, he shouldn't be involved in very high impact sports. And I don't think there's a way children will play football and they won't get to be hit or bruised or, fall down. So I'm sure you should be able to say, maybe you may not be able to play football as you want, but you can do other less impactful sports that, and it has to be minimal sports because of your condition. And then, of course, the whole movement to the adult clinic should be explained. Support group was good and all of that. Thank you, but you tried. Thank you so much.
Thank you so much, Dr. Chineme. Thank you so much. Thank you so much, the other people who made comments too. Okay, so I think we'll move on to our teachers now. Marcus Tago.
Oh, thank you so much. Dr. Brown improved in the second. Dr. Brown improved in the second session, so thank you. I must appreciate Dr. Chineme. Her comments was quite wonderful. Dr. Francis too. I think the other person, I didn't get the name. Thank you for your comments. 52, Chief Cookie. I don't know if any of you have comments. Fatima too. Copy any comments?
Yeah. Dr. Christopher, yes. I think my major comment will be that Dr. Brown needs to be a little more natural when he's doing his counseling. Okay, you should learn to flow with things. And then there's one thing we'll be missing in most of our counseling sessions that I want us to try and imbibe. Always try and ask the person how the person wishes to be addressed. Okay, it's like in the first session he did when he said, "Oh, is your mom? Yeah, who came with you?" And he said the mom was around. And the mom came in and he was calling the mom mommy. Some people may not like it. All right. So it's always good to ask the person, "Oh, can I call you this?" And the person will be fine. Okay. If his name is John, for instance, okay. "Oh, can I call you John?" And he may say, "No, don't call me John. I don't like that name. Call me Bob or something." You understand? So it's important for us to get the name of how the person wishes to be addressed. And then there are some statements that we should try and avoid saying, like referring to the condition as something peculiar to him. So you could use terms like, terms like, what we have on ground or what is here or things like that. And then when the patient told you about his former clinic and how things were in that clinic and he wanted to come in, I think it's important for us to also note that, he's coming to a new clinic. You cannot do everything the same way the whole clinic was. But the idea is that, we will try and look at each of those things. Not that you will do it, we will try and, put those things together. Although this clinic is slightly different because you're older now and you may have different requirements and different needs from when you were, so going to the pediatric clinic. You're a big boy now, so, we have to do big boy things and things like that. Just to let the person know that it will not be exactly like the pediatric clinic. Okay, maybe in pediatric clinic, maybe there were toys, video games, and things like that. Then now you don't have that. You may not have that available in the adult clinic, things like that. So you may not be able to do everything you want to do that they did in pediatric clinic here as well. Yeah, those are the things I just wanted to add. But the second trial was much better.
Thank you, sir.
All right. Thank you, Dr. Shito, for the comments. I'd want to emphasize, Dr. Brown, that the very first thing you are supposed to do in this scenario is to create rapport. Okay? And
Yes,
you are
sir.
not seeing him that. You didn't even ask him his name. May I call you this? So if, for example, you ask him his name and he says, "My name is Jimmy Brown." And ask him, "Oh, may I call you Jimmy?" That kind of tends to make the person more relaxed when you are on a first name basis. Well, I'm Dr. Brown. But you can just call me Dr. Brown. Look at the way he talked to you about Dr. Sarah. It was because they were at that level. It was because he was at that level with Dr. Sarah. Mind you, Sarah is unlikely to be her surname. You understand? Okay, so now, again, there's this issue I usually have with the setting. You say, "Are you comfortable here or should we go elsewhere?" Where is elsewhere? Why don't you say, could we enter my office? Okay, or do you mind sitting down in the consulting room here? So you are talking about a particular setting. This, are you comfortable here? Where is here? Okay, so it's better to do that. If you have an office, you can say, "Oh, do you mind coming into my office? Could you sit down? Do you want a cup of coffee?" Those are the ways to make somebody relax. Or do you want a cup of tea? Something like that. You might not need to go to these details, but at least say somewhere. It's not, "Are you comfortable here or should we go elsewhere?" No, that's too general. All right. Okay, so now because all these settings and the creating rapport, they are so critical in this kind of scenario where you're trying to convince somebody that you will do as well or at least or even better if possible than where he's coming from, and you want the person to be comfortable with you. So you have to create a good rapport. The setting has to be beautiful and make him more relaxed. Remember, he's anxious. You want to make him allay his anxiety. Okay, so now I still feel as if there are some parts of the questions you did not answer. Like, what investigations would you do for him? How would you manage this patient from now on? You're still, well, you tried a little bit, but you still didn't answer many of the questions. And then, just as they said, you cannot say you will do exactly what they did. Or if you're going to do exactly what the pediatricians did, then what's the essence of the migration? Is it just because of the number 18? Is it a magic number? That cannot be. If it's just because of the number 18, then Dr. Sarah can as well continue managing him, sorry. So, but because there are some peculiarities with the adults, with adulthood, okay, there might be some changes. Maybe the dose of the medication could change. The way his social interaction, he can't continue to interact with children because he's no longer a child. So these are the particular things. That's why you have to tell him categorically that, well, actually, the pediatric clinic here is very good. However, you're not an adult, and there might be need for you to interact more with adults, okay? Because at this point in time, it will help your management, your clinic. We want you to start attending group discussions with people who have a similar illness. Studies have shown that this actually helps patients and even helps us as doctors in the management of this particular type of illness. So you make them understand why there's a need to move. Okay, fine. Okay, you may understand with him that, okay, there's still, because there's an inertia, there's this resistance to change that everyone has. Okay, so that's when you start suggesting that, oh, this Dr. Sarah, don't worry, Dr. Sarah, I'm sure Dr. Sarah will still continue to be your friend. Okay, even initially when we start the movement, Dr. Sarah might still be coming around to say hi until you are used to us. Okay, so those are the ways to make them more comfortable and more relaxed. So in fact, some children will be, some of them will be so, oh, you mean Dr. Sarah can come and see me even in your clinic? You say, yes, why not? This hospital, anyone can come here. Do you want me to call her right now? You know, so there are ways to really make your patients to feel comfortable, and that's the most important thing here, so that they will be able to transition to the clinic. If not, actually, the importance of this is that the patient can decide to stop coming completely. And you wouldn't want that. You want the patient to be compliant with medication and clinic visit. So if they're not comfortable, you will see many situations where patients can even decide that if they're going to die, let them die. I don't want to go to that nonsense hospital. The doctors are this, the doctors are harsh, doctors are the other one, the nurses are, you know. So, and that's the essence of this transitioning process. You need them to understand that you will try as much as possible to maintain the quality of care, even though they are changing. In fact, in some cases, you might need to even be joining the pediatric clinic. You might still continue with the pediatric clinic. You continue to join them there. They'll be seeing your face and then tell him that, okay, don't worry, for so times, you might still be going to the pediatric clinic. I'll be joining them. I will be seeing you together. By so doing, I'll also learn the things that they are doing that I can adapt when you come over to the adult clinic, so that after so time, I can now come to the adult clinic and I'll try and apply some of the things that I would have learned when I come to, you know, so there's so many things in it. Thank you so much. I don't want to take too much time.
Thank you, sir. Thank you, sir.
Thank you so much, Dr. Remigus. Thank you. Thank you. Dr. Brown, you heard all the corrections. I'm sure the other participant too. Please take note of the corrections just in case something similar comes up. So thank you so much,
Thank you, ma'am.
Thank you, our class reps and our participants. Thank you so much. Dr. Fatima, please, you can close the class. Dr. Fatima.
So, thank you, our class reps. Many thanks to both presenters today. We had two wonderful presentations. The first one is straightforward. Please go over the slides and just assimilate it. as it comes in the exams. Then the second one is a communication station. And please, we need to rehearse this communication. Try and be doing it to your patients so that it becomes part of you, as Chief Remigos always say. And many thanks to all facilitators that came around. I wish you a wonderful day ahead. Thank you.
Bye, everyone.
Oh, bye, everyone. Have a wonderful day.
Bye.